Hi, good evening. Steve Adler. You got a minute? We're going to go through the virus numbers tonight. Just a brief message on a really important day that is tomorrow, but we're not going to be long tonight. Let's begin with the first one of our dashboards off the city's website. Always start with hospitalizations because that's ultimately where we're going to be tested. So if Janine would take us to that first dashboard. First dashboard talks to us about the number of hospitalizations that we have. And I don't know if it's coming up tonight. I can give you that number, kind of like the way that we used to. So here's the chart for tonight. On the first dashboard, you can see we're at 14 cases. Is the 7 daily average. 23 are the number of hospitalizations that we had. It's above the average. You can see the number there. 23 new today, 14 7-day average. Number of new cases is 155 new cases. That's the number to the right. This case number seems to be fluctuating, but you have to look for general trends. Yesterday, Sunday, we had 3 cases, just 3. Might be the fact that it's the weekend, but you can see the 7-day running average is 117. We were at 155. I'm going to talk for a second about those cases in a little bit more detail. Take a look at the next chart that we have. This is the second dashboard from the city of Austin. We're going to take a look at hospitalizations. 91 in our hospitals tonight. 7-day running average in the city is 82. So this is the first time in a while that we have seen the number of people in our hospital exceeding the 7-day average. That's a concern. Number of people in the ICUs tonight, 32 people. The 7-day running average, 28. So again, first time in a long time that we've had more people than our 7-day running average. That indicates then that we may be trending upwards. Number of people on ventilators, the 7-day moving average is 15, and we have 19 on ventilators. Again, each of those are a concern for us. Let me show you the chart that is just of cases. Now remember, cases is a number that fluctuates. It depends, to the number of tests that we give, and also the reporting that we get back from the state. Here's a chart from Dr. Escott. It shows new confirmed cases in the city, and you can see about a week to 10 days ago, we reached our low point. That's the blue line is what we have on every day. The yellow line is smoothed out to show you the 7-day running average, and you can see that our total number of new cases has started going back up. Now, it hasn't gone up a lot, but that is of concern. We have to continue to watch that. There could be reasons why the cases are going up. Could be Labor Day that we had. Now would be about the time we would be seeing that kind of action if it was Labor Day. We had 40,000 people that came to our city to flee the hurricane. They were here for a few days. That could have been something that created this. This could be new cases that we're seeing now, increases, we know, with students that are now back in school doing weight training and the like. Right now, a lot of those kids are staying contained. Certainly, it looks like the university kids are. But the concern is that those young kids, even if they don't end up in the hospital, end up as confirmed cases, they infect other people that start showing up. So the governor's opened things up, and we want to open things up. We want to open up businesses. I wish we weren't doing it quite at this speed. I wish we were holding off a little bit more so we could run those variables through our system so that we could figure out what's happening here with this little uptick with respect to cases. But what I do know, and what we learned in May and what we learned in July, is that if we are disciplined as a community and wearing our masks religiously, doing our social distancing, that we can stop this virus in its tracks. And that's what we need people to do. You see something like this, your first thought needs to be, Everybody needs to be wearing masking. If you're going to go to a restaurant, better to be outside in a restaurant than inside in a restaurant. Make sure you only go to a restaurant where all the wait people are wearing masks, where people are putting on masks to go to and from the restrooms when they get up. Go to places where people are being real disciplined. That's what we can do. That's the control we have. And we need to find out as we open up the economy if we can hold everything in check by staying religiously tied to wearing face coverings. What we've seen are cities all across the country, all across the world, that when they get to where we are right now, they can't hold it and they can't sustain it. England got down to pretty low numbers, and then they started opening up the pubs in England because everybody in England wanted to open up the pubs again, and now they're having to really pull back in England, given that the numbers are starting to go up. You just can't pretend like this virus is not there or it's not as infectious as it used to be. Let's be the city that stays disciplined. And what we know is that if somebody walks into a room and 75% of the people are wearing masks, they're going to put on a mask too. If they walk into the room and only 25% are, then it's probably something that they don't do. It's the pressure and the influence and the culture that we set that other people follow in the community. All right, I want to close just by talking about tomorrow is National Voter Registration Day. I know we're doing this a day early, but happy National Voter Registration Day. It is a national designated day to celebrate our democracy. It was first observed in 2012. And millions of people have been registered on this day since then. It's gained momentum every year. In fact, I think about 3 million people have registered on this day since its inception as a designated day of celebration in 2012. This is going to be an incredibly important year for people to be registered and to vote. Here in Texas, you have to be registered by October 5th. So it's only a week or so away. You need to get registered. This is an important one. You want to vote in the presidential election. We have a U.S. Senator up. We have our Congress, members of Congress up for election. We have our state reps up for election. We have city council offices that are up for election, and you have the opportunity to vote in this community on Prop A and actually bring a mass public transit system to this city for what it'll do for traffic and climate change and the like. If you haven't registered yet, or you want to check your registration status to see if you are, you can request a form at movetexas.org/register. movetexas.org/register, and you can check all that out. Please, please, please make sure that you're registered. Make sure all your friends, all your family members register too. And with that, I want to wish you a good evening. Take care and be safe.